So thank you very much, Flora, for having me.
You're
Yes, my
welcome.
name is Abimbola Adebakin. I'm a pharmacist. I'm also a certified performance technologist. And that simply means I look for areas of improvement at different levels, maybe at an individual level, at an organizational level, or even at an industry level. So I have worked in a number of places. I think when we're talking further, I'll be able to show how I have worked from pharmacy to business consulting to entrepreneurship development. And in consulting, I have worked in different diverse sectors: power, insurance, finance, banking, agriculture, so many areas. So I have what you can say an eclectic background,
Yeah,
and I think it has enriched who I am and where I am today.
yeah, great. Looking forward to hearing about that. We'll do that after the break. So, one of the things that I really want to talk about, and I'm so impressed with what's been happening with my pharmacy. Uh, and I mean, we've known each other probably about 4 years, really. And the My Medicines was one of the areas that I knew that you were
Yeah,
working on,
yeah.
and then my farm with the launch of my pharmacy. I'm really curious, what are the things in your career that have kind of led you to this space where you are looking at such a robust, holistic working environment of many collaborators across a number of spaces
Okay.
that you are kind of in the center of, as opposed to I know that you're not just a pharmacist, but it's been a core part, certainly in terms of your background learning. But that's not just all you want to be. Can you
Okay.
give some insight to how you found yourself in this space that you're choosing to operate in?
Okay, I think I believe strongly that anything that should be built must be sustainable. And if you want something sustainable, you must build structure, systems, and processes that are reproducible. And I've seen that over and over, but I've seen it more in other sectors. So I think there's this discomfort I have that with my own sector, the healthcare sector, there could be much more growth. We've got 1 billion people in Africa that need to be served better. Healthcare is maybe one of the top 6 sectors in the continent that that leads to our
Yeah,
economic development. And so after food, after clothing, after shelter, it's healthcare. So if we get healthcare right, then we get the care of human beings right. And I think God will be pleased with us
yeah.
on
I
that
like I like
level.
that bit.
So
I
this
like
is
that
us
bit.
this is me and my team bringing what we know that helps businesses to grow. We're bringing it into our own sector.
Yeah,
And when I say our own, I have a background in pharmacy, but I have worked more than half of my career outside healthcare. But I find myself coming back. So this is my third journey back
yeah,
into pharmacy. Now, all over Africa, look at the 6 sectors that create development. We have clothing or fashion, we have housing, and we have food. Healthcare is next to them. And if we can get healthcare right, then we have many things
yeah.
right.
Very true. Very true. There's something about how you have, and I love the way you said that you find yourself going back or coming back into the pharmacy, having worked across a diverse number of industries anyway. How would you, what are the words that you would use to, or phrases, I guess, that you would use to define yourself in terms of the life career choices that you make? And
Ah,
I mean this holistically as well.
okay.
Yeah, beyond just work, even how you tend to live your life.
I think I'm a quiet performer,
Mm,
if that's a phrase I can
yeah.
use. But I tend to think, why not? I helped my mom when I was still in the university. I helped her run a salon. So she had retired as a teacher, but then we had space at home and we thought the salon was missing, a modern one in the neighborhood. So I learned how to make hair
Wow.
and cut hair and do all of the braids and all. Then I would find workers who would say, oh, this cannot be done, that cannot be done. And that was when I discovered myself constantly saying, why not? Let's try it. And it would work. So I'm typically the one who goes for things. So there's a can-do spirit in me.
Yeah.
And I think that's how we tackle issues right now at Advantage Health Africa. One of our core values is we're audacious, meaning we see a big, hairy, scary issue, and we don't think we should leave it alone. Maybe we should leave some things alone. But no, we don't quite leave it alone. We think, you know what, there might be a solution. And it doesn't have to be you creating it afresh. It might be existing in another country. You might look at peer countries, look at India, look at Bangladesh, find it in Mexico or Brazil, or you might find it in another sector. So you might find there are solutions in the financial services or telecoms or even in entertainment that we can bring on board. And I'll give you a good example. Healthcare right now comprises prevention, treatment, and even support afterward. Many people focus on the treatment. But in prevention, if we're able to prevent well, then we will have fewer bad cases that we need to treat and spend all of that money on. That's about really the concept of universal healthcare. Now, I don't think we do enough of prevention. And in prevention, we need to bring in the techniques that are used in the entertainment sector to send a message. Bring that into healthcare and make healthcare interesting. Make people interested in caring for themselves. So when I came back and I launched mymedicines.com, we were focused on the graphics we used. We made sure our graphics was such that people felt nice, felt good getting it, and it wasn't a nuisance. And they could read the points in 3 highlights or 4, and we used methods that you use to send a message and makes it viral in social media, using social media. That to me is what we do. We find methods and models that exist elsewhere, and we bring it into healthcare.
Love that. We'll be back after the break.